All right, good morning, or good afternoon, class. Can everyone hear me? Okay, so we're going to jump right in and start talking about our next major body system set of diseases. And today we're going to focus on nervous system diseases. Okay, so the first thing that I'll do very briefly is to just very quickly go over the parts of the nervous system. Some of this you might remember from your A&P1, but your nervous system is basically divided up into central nervous system and peripheral nervous system. The central nervous system primarily includes the brain and the spinal cord, and the peripheral nervous system includes everything else that's outside of the brain and spinal cord. So it includes all those sensory nerves and motor nerves and that kind of thing. So anything that's outside of the brain and spinal cord would be part of the peripheral nervous system. One of the first sets of diseases that we're going to talk about today is meningitis. And meningitis is an infection and inflammation in the meninges, which is this protective connective tissue covering outside of the brain and the spinal cord. So real quick, let's just kind of review the parts of the meninges. So the outermost layer of the meninges is what's called the dura mater. Okay, so we call it the dura mater. Oops. Hold on one second here. All right, so it's called dura mater. And then, so this is the part of the meninges that would be closer to the inside surface of the skull. And then underneath that, we have the arachnoid mater. And then the most internal layer of the meninges is the pia mater. The pia mater is the part of meninges that actually touches the outside covering of the brain and the spinal cord. But of course, we have to remember that in between the arachnoid and the pia, there is this space that's called the subarachnoid space. And does anybody remember what that subarachnoid space is full of? What does it have in it? Yes, CSF. It has cerebrospinal fluid in it. Okay. Okay. Now, when we think of how microorganisms can get to the central nervous system, initially we might think, well, it's kind of hard. Like, how do these organisms get to the brain and spinal cord? Well, it's actually pretty easy. Many of these organisms that we're going to talk about, they actually first they find their way to the blood, and they use the bloodstream as a major highway to get to a lot of different organs, including the brain and the spinal cord. So the bloodstream is going to be probably the most important pathway that microorganisms use to get to the brain. They can also use peripheral nerves. So if you think about these sensory nerves bringing in sensory information from, say, your skin to your central nervous system, some bacteria and viruses can actually hitch a ride along a nerve and get to the brain and spinal cord. And we'll talk about some examples of that. And then now, to a minor extent, your bones could also serve as a pathway. Now, when I say bones, what I'm really talking about is a break in a bone or a fracture in a bone. Bones are very rich in blood, and they're also very rich in nerves. So let's say that somebody has a compound fracture where the bone is actually sticking out through the skin, and it gets infected and spreads from there to the bones and to the blood and the nerves, and that could serve as a way to cause an infection. So obviously, neurological diseases are caused by many different things, from bacteria, viruses, fungal organisms, protozoa, and prions. Now, most of the organisms that we're going to spend a lot of time talking about are bacterial causes of neurological diseases, but we're also going to talk about some of these other causes as well. And the first set of diseases that we're going to talk about today is meningitis. And whenever you hear a person having meningitis, most likely that person has what's called bacterial meningitis, which is caused by some bacterium. So bacterial meningitis is the most common cause of meningitis. But in rare instances, meningitis can be caused by fungal organisms. That's usually more of a problem for the immunocompromised. And in other rare instances, meningitis can be caused by viruses. And we'll talk about a few of those, but the number one cause of meningitis in human beings is bacteria. So we're going to kind of focus on that. So with bacterial meningitis, when a person has bacterial meningitis, even though any part of the meninges can be affected, it's usually the pia mater. Okay, usually the pia mater is affected. And one of the things that we're going to see with bacterial meningitis is that almost every single type of bacterial meningitis is spread from salivary secretions from an infected individual. It might be through, sharing a drinking cup or an eating utensil or a toy that has the saliva from an infected individual on it, and a person comes into contact with that contaminated saliva, and it'll start off as an infection in the throat, like in the upper respiratory tract, like in the pharynx and even the nasopharynx. And the reason I'm talking about that is because a lot of the initial symptoms can be misleading. A lot of the initial symptoms resemble the cold or the flu. A person might have like a fever and a headache. So, it really resembles flu-like symptoms. But then the symptoms progress into like a stiff neck. And that stiffness in the neck is usually a result of the inflammation in the meninges. And then later symptoms would include nausea, vomiting, convulsion, and even coma. And people can, of course, in very severe cases, die from bacterial meningitis. Some other signs and symptoms that can go along with help diagnosis of meningitis is really observing the cerebrospinal fluid. So, normally the cerebrospinal fluid should be clear. It should look like a lot like plasma. But if a spinal tap is done on an individual that's suspected of having meningitis, if the cerebrospinal fluid looks kind of like a milky white color, that indicates that white blood cells are moving in. And the only reason that white blood cells would be moving into the CSF is if there are bacteria there. So a milky white sort of appearance to the CSF would indicate possible meningitis. Now, there are some other signs that I want to talk about here that are not in your notes, but I thought they were fun and interesting to think about because there are a lot of different things that we can use to diagnose a person with meningitis. So one of these kind of interesting signs is something that's referred to as a Brudzinski's sign. Okay, and a Brudzinski's sign is where the patient would begin by lying flat on their back, and then the physician would take their hands and manually, hold the head of the patient and flex the neck. So they're actually manually flexing the neck, and it's almost like a reflex. When the neck is flexed, the knees automatically, like a reflex, they get flexed. And it's, again, probably due to the inflammatory reaction that's happening in the meninges as they're being infected. And then another kind of similar sign is referred to as Koenig's sign. This is where the patient, again, is lying flat on their back. And now the physician would try to raise and fully extend and straighten the leg out. Okay, so fully straighten the knee, but they can't. The knee tends to stay in that permanently flexed position. So that's a sign that's called Koenig's sign. Okay, now the way that we're going to discuss meningitis is by talking about them based on age group. Okay, and the first age group that we're going to talk about is newborns. Okay, so we have newborn causes of meningitis. And out of all the cases of newborn meningitis, the number one cause of bacterial meningitis in newborns is Streptococcus agalacea. So this is like number one. Out of all the cases of meningitis worldwide, this accounts for about 70% of all newborn cases. Okay, and it's estimated that anywhere from between 15 to 40 to almost 50% of pregnant women already carry this in their genitourinary tract. In fact, it's something that's usually tested for about a month or two before a pregnant woman gives birth. They usually test for this by taking a swab. And if a pregnant woman is positive for the presence of this bacteria, they're usually put on antibiotics to reduce the concentration. And that's because if that bacteria is still there, during birth, the bacteria can be transmitted from the genitourinary tract of the woman into the mouth of the baby. And then it goes from the mouth to the throat, and then from the throat into the blood, and then the blood carries it to the meninges. Okay, so very important to test for this, and if positive, get treated for this, because again, this can cause a very severe form of meningitis in newborns. It's the number one cause. Now, number 2 on the list, probably a distant second, is E. coli. Well, E. coli, we have E. coli in our large intestine. And so, of course, pregnant women would also have E. coli in their large intestine, and it's usually released in feces. Okay. And so if the E. coli from feces gets into the genitourinary tract of a woman during birth, the E. coli bacteria can get transmitted from the woman into the mouth of the baby again, and then into the throat, and then into the blood, and the blood carries the meninges. Okay, so those 2. Now, there is another bacteria that can be, okay, and I say can be, a very rare cause of bacterial meningitis, and the name of that bacteria is Listeria monocytogenes. Okay. And it typically causes a disease called listeriosis. All right, now, Listeria monocytogenes is a gram-positive rod-shaped bacterium, so it's a bacillus. And the way that it's usually transmitted is from contaminated food. So it's technically a foodborne disease. The bacteria kind of naturally lives in the soil. It's a very common bacteria in the soil. And it can get into, it's usually released in animal feces, it can get into water, and sometimes it can get onto food. And the types of foods that it usually contaminates are foods that are not cooked very well, or foods that have especially a lot of dairy in it. So either like non-cooked foods or dairy products. So for example, sometimes we'll hear of ice cream or certain types of cheeses get contaminated with it. But it's not just dairy products. It could be other things. Just to kind of give you a couple of more, I guess, fairly recent examples. A couple of years ago, there was Listeria contamination in a brand of ice cream called Bluebell ice cream. I don't know if any of you all remember that. And so many people contracted Listeria from eating Bluebell ice cream, and they had to pull the Bluebell ice cream off the shelf. And then, there were a few cases of people getting Listeria from a brand of hummus that was sold at Costco, and they had to pull the Costco off. So, think about hummus. It's not something that's really cooked very well. Ice cream, definitely not cooked, but also certain cheeses can also carry it. So it's mostly a foodborne illness, but what can happen is people that have a healthy immune system really don't have to worry about this at all. A person that has a weak immune system might have to worry about this, and pregnant women would have to worry about this. Now, when I say pregnant women would have to worry about this, it's not her. It doesn't really cause a lot of problems in the pregnant woman. The problem is that the bacteria can cross the placenta and get into the fetus and infect the fetus. And the fetus will, in most cases, be either spontaneously aborted or be stillborn. If they are born alive, a lot of times it can cause meningitis of the newborn. All right, but again, it's a rare form of meningitis in newborns. So if we look at these 3 causes of newborn meningitis, the absolute most common cause is Streptococcus agalacea. A distant second is E. coli. And then way, way, way down at the bottom of the list, a very rare case is Listeria monocytogenes. Okay. All right. Now, we're going to move into our next age group. And our next age group is preschoolers. Okay. And the number one cause of bacterial meningitis in preschoolers is Haemophilus influenza type B, sometimes often referred to as HIB. Okay. Now, This bacteria can also be easily spread from saliva. And initially, it can cause an infection in the throat. And then from the throat, it moves into the blood. And the blood carries the meninges. So again, same sort of pattern of pathogenesis. And we used to see more cases of bacterial meningitis caused by this bacteria. It used to be a really serious childhood disease, but it's not anymore, because most children within the first month or so after they're born receive what's called the Hib vaccine. So the Hib vaccine protects against meningitis caused by Haemophilus influenza type B. But the Hib vaccine also protects against another disease caused by this bacteria. Does anybody remember what that other disease is? That's correct. It's called epiglottitis, which is an infection in the epiglottis. So vaccination protects against meningitis caused by this bacteria and epiglottitis. All right, now our next age group. We're talking about now, we are with school age children, so kindergarten, first grade, second grade, and the number one cause of bacterial meningitis in school age children is Neisseria meningitidis. Okay, sometimes they'll refer to the meningitis caused by this bacteria as meningococcal meningitis, because if you look at this bacteria under the microscope, it is a coccus. It's a round bacteria, and they always arrange themselves as not just one, but two cocci stuck together. It's an arrangement that we refer to as a diplococcus arrangement. So it's a very classic sort of identification tool, a diplococcus arrangement. So they call this meningococcal meningitis because it causes meningitis, but it's a coccus-shaped bacteria. This one is also, again, surprise, surprise, it's transmitted through salivary secretions, and it will initially cause an infection in the throat, and then it spreads into the blood, causing bacteremia, and the blood carries it to the meninges. So again, throat, blood, meninges, throat, blood, meninges. That seems to be the common theme here. So even though it's transmitted the same way as the others, there is one thing that one sign that is unique to this type of meningitis that we do not see in the others. And what that is it looks like a rash on the skin, but it's something that's called petechiae. Okay, what petechiae looks like is this. So if you look at this picture here, we see this patient that has these little red spots. Looks like a red rash on the skin, but it's not really a rash. What that basically is where the bacteria is causing hemorrhaging of blood vessels in the skin. So you basically have localized areas of bleeding in the skin here. And it can spread, it can get worse to cause even more widespread hemorrhaging, like what you see in this picture. And of course, this has to be treated immediately. And some of the antibiotics that are usually given to treat this are things like, penicillin could be used, chloramphenicol could be used, but if a person receives chloramphenicol, what is the side effect that they would have to worry about with being given chloramphenicol? Aplastic anemia, because it can destroy bone marrow. Exactly. Now, another thing about this bacteria is if there are people in the family that are not infected, we can protect them by giving them rifampin. So rifampin is usually given as a prophylactic treatment to prevent infections in the uninfected members of the family. Okay. So yeah. Now, in adults, so we're at adults. The most common cause of bacterial meningitis in adults is Streptococcus pneumoniae. This is the same bacteria that causes pneumonia, and it can cause other diseases, but in adults, it can cause bacterial meningitis. and it's spread the same way, through respiratory secretions and then causing a infection in the upper respiratory tract, spreading to the blood and to the meninges. And adults usually get it, again, by sharing drinking cups, eating utensils. Especially we might see more cases of it where in student dorms, military barracks, where people are kind of in close environments and they're sharing items of, things that might carry the saliva. So where we see more cases of it there. And out of all of the cases of meningitis, Streptococcus pneumonia has the highest mortality rate. This one has a mortality rate of about 46%. When compared to Neisseria meningitidis, that one's got about 17%, and Haemophilus influenza's mortality rate is 11%. Okay, so again, Streptococcus pneumonia is more worrisome than the others. So again, the common theme here with all of these forms of meningitis is that starts off as a throat infection, okay, and then it moves into the blood causing bacteremia, and then the blood carries it to the meninges. And as far as diagnosing it, we can culture the cerebrospinal fluid. Normally, the cerebrospinal fluid should look clear. If it appears cloudy, that would indicate that. You could also use a blood culture. So normally, if you take a sample of a person's blood and put it onto a plate, should anything grow normally? No, because your blood is sterile. But if something grows, that could indicate, where this might have come from. And using all these signs and symptoms in conjunction with the fever, the stiffness in the neck, and some of those other things can also be used as a diagnosis. Now, fungi can cause meningitis, but this is really rare. The only people that really have to worry about meningitis caused by a fungus are people that are immunocompromised, mainly people with AIDS. There is a type of fungus that's called Cryptococcus neoformans. I think we might have mentioned it before. And what can happen is that a person can inhale this, and it gets into the lungs, and then from the lungs it spreads into the blood, and then the blood carries it to the meninges. And people with healthy immune systems don't have any symptoms at all. They can get rid of this, no problem. But the immunocompromised, it can spread into the brain and cause a very severe, meningitis infection there. And since this is a fungal infection in a body system, the number one treatment for fungal infections in a system is amphotericin B. Now, there is a virus that can cause meningitis, but I'm going to reserve talking about that until later. Okay, we'll talk about that when we get to viruses. So let's talk about some other bacterial diseases of the nervous system. So the three that I want to focus on now are tetanus, botulism, and leprosy. So at the end of lecture on Monday, I briefly talked about tetanus because on the one hand, it is considered to be a skin disease because the only way that you can get tetanus is by being punctured, your skin being punctured by a sharp object containing the endospore. So it's like a skin wound infection. But it's really actually a nervous system disease because when a person is suffering from tetanus, the toxin that this bacteria makes is affecting the nervous system. And I'll kind of talk about how it's doing that. We typically see, less than 50 cases per year. It definitely doesn't go beyond that. Rarely it doesn't do that. And this bacteria, once it starts growing and dividing, this makes a toxin that's called the tetanospasmin toxin. Okay, now, to describe what this toxin does, so think about like if you were contracting a muscle on your body. So let's say that you wanted to contract the biceps muscle so that you can flex your elbow. Well, whenever you contract a muscle, any muscle on one side of the body, the muscles on the opposite side should relax. You don't want to have both muscles on both sides contracting. But that's what the tetanospasmin toxin does. it causes muscles on both sides of the body to contract. Okay, and it's really affecting the nerves that are innervating those muscles. So again, normally, if you're contracting a muscle on one side of the body, you have a neuron coming from your brain that tells that muscle to send an action potential to contract. But on the other side, you have another neuron telling the muscles on the other side to not not generate an action potential and to not contract. Well, the tetanospasmin toxin tells the nerve on the other side of the body to start sending out excitatory signals, resulting in contraction of the muscle on the opposite side. Okay, and this is what results in unopposed contractions of muscles on both sides of the body. It can get so bad that a person can suffer from this extreme version of this called opisthotonos, where all of the muscles are contracting. What you're looking at here, this is a portrait of a French soldier. I don't know the year, but it's probably the mid to 18, somewhere around the 1800s. This soldier had a wound that got infected with tetanus, and the person got tetanus. And what you're seeing here is that every single muscle in the body is contracted. It can get so bad that the muscles in the back will cause the back to arch over, like what you're seeing in the picture, and they can actually literally crack their spine and die from this. This child here has tetanus, it looks like, in the hands and a little bit in the face here. And tetanus is a disease that is considered to be an intoxication. So you obviously have to be infected with the bacteria, but what's really causing tetanus is the toxin. It's not the bacteria, it's the toxin. So to put this into perspective, I mean, I could use antibiotics to kill the bacteria. But if that's all I did during the treatment, then the person would still have tetanus. You also have to get rid of the toxin. You have to neutralize the toxin somehow. So because the toxin is what's really making all the problems, that's why it's considered to be an intoxication. So the best way to prevent getting tetanus is to get the tetanus vaccine, which is a toxoid. Remember that a toxoid is it's an inactive version of the real toxin. They treat it with chemicals so that when they inject it into you, it doesn't actually cause tetanus, but it helps you to boost your immunity so that if you're ever exposed to the real thing, you can react against it. And you basically need a booster shot about every 10 years or so. That's usually the recommendation. But let's say that a person was not vaccinated and they contracted tetanus. Not only would antibiotics have to be given to kill the bacteria, but you would also have to give them a tetanus immunoglobulin. So the tetanus immunoglobulin is nothing more than the antibodies against the toxin. Okay, antibodies against the toxin. That's how you treat it. All right, our next bacterial disease of the nervous system, botulism. Okay, so botulism is caused by the bacterium Clostridium botulinum. And it makes one of the most powerful toxins that we know of that's made by bacteria. The toxin that it makes is called the botulinum toxin, or more commonly known as Botox. All right. Now, what this toxin can do, all right? So actually to do this, I'm going to pull up a whiteboard here. To really explain what the toxin does, I have to kind of really briefly go through your nervous and muscle physiology from your anatomy and physiology 1 days. But let's say that I have this muscle. All right, so if I can draw here, hold on. Give me a second. Let's say I've got this muscle here and I want to contract it so I can move some limb, just anywhere on the body. Well, remember that every muscle has a motor neuron that communicates with it. So this is a motor neuron here. And this part of the motor neuron is referred to as the synaptic terminal. And within that synaptic terminal, there are these little vesicles that contain this really important neurotransmitter. Does anybody remember what that neurotransmitter is called? Right, acetylcholine. So when you think about moving a muscle, this neuron would generate its own action potential and then trigger the release of this acetylcholine. And then when that acetylcholine is released, it binds to these receptors on the surface of the muscle that are called acetylcholine or ACH receptors. Okay. So the acetylcholine binds, and again, I don't want to go through the whole thing, but then after that happens, you generate an action potential that eventually causes contraction of the muscle. All right. So what does this have to do with botulism? Well, the toxin inhibits the release of acetylcholine from the neuron. So no acetylcholine, no action potential, no contraction of the muscle. And the primary outcome of this is that it can cause flaccid paralysis. So we go back here. Okay, so it results in flaccid paralysis of the muscles. It can get so bad that the toxin can spread and affect the phrenic nerves, the nerves that innervate the diaphragm, and cause that to be paralyzed, and there could be problems with breathing. All right, now, even though botulism is really it's a very serious disease, it's also very rare, and most of the cases of botulism that we hear of are usually foodborne cases where a person eats contaminated food, and most of those cases are in infants. Of course, adults can get botulism, but the cases of adult botulism are less severe than in infants. In infants, it tends to be a lot more severe because they lack normal flora bacteria that can compete with this one to prevent the disease. And the types of foods that are more susceptible to being infected are foods that, for example, don't have a lot of oxygen in them. So like canned foods or jarred foods, where during the processing and canning of and jarring of those foods, a lot of the oxygen is sucked out of it to preserve the food. And if somehow the bacteria were to get in there, they could contaminate those foods and cause release of the toxin. And also another thing is that infants, especially infants that are less than 1 year of age, should never be given honey, especially like raw unpasteurized honey, because sometimes this raw unpasteurized honey can contain the endospores from the bacteria. And if a baby, especially less than 1 year, eats that, they could get botulism. Okay, so that's why most doctors will recommend that babies, they don't, especially in the first year of life, they don't eat any type of honey. And botulism is another disease that is considered to be an intoxication, because you can kill 100% of the bacteria with antibiotics. That's not the problem. But if that is all you did, the person would still have botulism. So as part of the treatment for it, if a person were to get botulism, you also have to provide the antitoxin, which again, anytime you see the word antitoxin, that is an antibody against the toxin. In addition to that, supportive care, if they're having trouble breathing, they might have to be put on a respirator, that kind of thing. And before I leave botulism, the other thing you might remember about botulism is that, well, it's used cosmetically. This is the Botox that some people use to smooth out the wrinkles in their face, to diminish the looks of aging. And what the toxin is doing in the face is it's literally paralyzing the muscles in the face. It's preventing the neurons in the face from releasing acetylcholine, and the muscles in the face are just paralyzed. Basically, they're literally paralyzed. And so, a lot of people will use this as a cosmetic treatment, but of course, when that's happened, you can't really tell if the person is happy or sad or worried, because their facial expressions are pretty much paralyzed. You can't tell what they're doing. Okay. So my next bacterial disease of the nervous system is leprosy. Now, a lot of people think that leprosy has been eradicated. It's like one of these diseases you probably read about in your history books or whatever. It was something that affected a lot of people a long, long time ago, but it's actually still out there. The bacteria that causes it is still out there. And we can sometimes hear of people getting leprosy. It's rare, okay? But there are more cases of leprosy in third world countries where people tend to live in very close living situations because the bacteria is usually spread from the nasal secretions of an infected individual. Okay. And so coming into close contact, like repeated close contact with an infected individual's nasal secretions, would increase the likelihood of a healthy individual becoming infected. Now, there is another way that a person can get infected, but it's a very rare way, and that is from an armadillo. So armadillos are actually a natural reservoir for possessing the bacteria. One of the reasons for this is because the body temperature of an armadillo is about 30 degrees Celsius. And that just happens to be the optimum body temperature at which this bacteria likes to grow. And so even though what I'm about to say is very rare, it has happened. There have been cases where people have, even in the United States, where people have been either bitten or scratched by an armadillo and have contracted this disease. Luckily, these days, it can be easily treated with antibiotics, but a long time ago, there weren't any antibiotics, so we didn't have that. Okay, now keep in mind the fact that this bacteria grows more optimally at lower body temperatures that are lower than body temperature. So its optimum growth temperature is about 30 to 33 degrees Celsius, and that's going to play a role in the pathogenesis of the disease. So with repeated contact with an infected individual, there are two forms of leprosy that may occur. There's what's called the tuberculoid form and the lepromatous form. Out of the two, the lepromatous form is the worst one. This one has the worst prognosis. It results in progressive disfigurement of the face and the limbs. So I'm going to focus on that one first. So the lepromatous form, the bacteria starts to grow in the skin, especially the skin in the area around the face, and also the skin in the area right around the fingers and the toes. You might be asking yourself, well, why the skin in the face and the skin around the fingers and the toes? Well, remember that this bacteria grows better at around 30 degrees Celsius. Well, the skin in those areas around your face and the fingers and the toes is less than body temperature. It's about this temperature. So when the bacteria enters those areas, it starts to grow and replicate, and it produces these really grotesque bulb-like lesions. And in the face, it's very disfiguring. I'll show you pictures of it here in a bit. And in the fingers and the toes, the bacteria is growing in the skin and the connective tissues around the fingers and toes. And it can get so bad that they start losing their fingers and their toes. They actually lose their limbs. And the reason that we're including this here as a nervous system disease is that as the connective tissue in the fingers and the hands and the toes and the feet are being lost, they're also losing nerves that are innervating those areas. So one of the symptoms of this is that they lose feeling. Even before the disfigurement happens, they, if they, for example, hold their hands up above a flame or something like that, or you touch their hands with something painful, they can't feel it. And this can happen even before the disfigurement happens. So they have progressive nerve loss, and then they have progressive loss of limbs. So this is what the lepromatous form looks like. So here in the face, what's causing this is that the bacteria is growing in the face and causing this progressive disfigurement here in the the fingers and the toes here. the connective tissue and the other is just being totally destroyed, so they actually lose their fingers and their toes and their hands and things like that. In addition to that, they're also losing sensation. So that is the worst form of tuberculosis. The other form of tuberculosis actually has a better prognosis. It's called the tuberculoid form. And it's still spread the same way through contact with an infected individual, but the lesions are much less severe. Here you have these little patches that don't have the bacteria. It's just kind of an inflammatory reaction against it. But this one with treatment has a pretty good prognosis. So again, it's usually transmitted through repeated direct contact with the respiratory secretions of an infected individual. So it's not like you come into contact with this person once, you have to be in repeated contact with that individual. And it has a fairly long incubation time. There have been cases of people that contracted it years ago and didn't really start showing signs and symptoms until years later, like 7 to 10 years later, even 20 years later. And there are several different things that you can use to treat it. One of those things, notably, is rifampin, which is actually one of the parts of the treatment for tuberculosis. Okay, so let's talk about some viral diseases of the nervous system. And we're going to talk about viral meningitis, which is rare, but it does happen, polio, and rabies. So viral meningitis. So first thing is that viral meningitis is very rare. And if it does happen, it's usually caused by a virus that's called an enterovirus. Now, this next part is something you don't need to know, but the enterovirus is in a family of viruses that's called the Picornaviridae family. And one thing that all of those members of that family have in common is that they're all naked viruses. The primary way that the enterovirus is spread is through a fecal oral route. Now, when you hear the phrase fecal oral route of spread, that means that the person has to eat or drink fecally contaminated food or water. Okay, it's not like they literally have to eat feces. Now, most people that become infected with this virus will either have no symptoms or develop some very mild cold or flu-like symptoms. It really only causes meningitis in about 1 to 1,000 people that get infected. So it can happen, but it's really rare. Okay. All right, now polio. So polio is one of these diseases that, well, at least in the United States, I think the last case of polio in the United States was like in 1979. And even though we don't see it here because of vaccination, it does exist in other countries, especially in countries where there's a lack of vaccines. But with that being said, polio used to be a very serious worldwide, not just epidemic, but pandemic. It used to be a very serious disease before the vaccine was developed. And one of the biggest things you heard of with people that got polio is that there was this paralysis that would go along with contracting polio. And I'll talk about how the polio virus can cause paralysis. But if you look at all the cases of polio that did occur, about 90% of individuals that can get infected with the polio virus are asymptomatic. And it really only caused paralysis in less than 1% of individuals that got infected. The virus is also, just like the last one we talked about, is also spread through a fecal oral route of transmission. Now, let's talk about, like, if this virus causes paralysis, how does it do that? Well, to really illustrate that, I kind of have to draw a picture. And I've got to go back, and you probably don't want me to do this, but I have to we have to kind of go over your spinal cord anatomy, especially the cross-sectional anatomy. So if I were to draw a cross-section of the spinal cord here, it would kind of look like this. So let's say that this is the dorsal side of the spinal cord, and over here we have the ventral side. And on the outside edges of the spinal cord we have white matter, but in this area here that looks kind of like a butterfly with wings, we have gray matter, which predominantly contains neuron cell bodies. Anyway, to make a long story short, again, I didn't want to go into all the specifics here, but on the dorsal side of the spinal cord, you have nerves that bring in sensory information. So you have these sensory input for sensations like touch, pressure, and pain coming in the dorsal side. But on the ventral side, you have these motor neurons that help to control muscle. So let's say, for example, that I have a muscle here that I want to control and contract. Well, coming from the anterior gray horn of the spinal cord, we have these motor neurons that will send axons out what we call the ventral root to the muscle to help control the function of that muscle and get it to contract. Well, what the poliovirus can do is it can kill off most of, if not all, of the motor neurons in the anterior gray horn. And when that happens, if there's no motor neurons controlling that muscle, then there's no action potential in that muscle, and the muscle is effectively paralyzed. Okay. Now, I say that it can kill the virus can kill most of these neurons in here, but sometimes it doesn't kill all of them. And I'll talk about something later on that will impact that. Let's kind of go back here to the slide. Give me a second here again. Sorry about that. Okay. So because it can kill those motor neurons, that's one of the things that can result in the paralysis. And it can get bad enough that can also affect the nerves that are innervating the diaphragm, mainly those phrenic nerves, and cause respiratory failure. A long time ago, again, in the early part of last century, there were a lot of people that were having difficulties, not just getting paralyzed, but also trouble breathing because of the nerve damage controlling the diaphragm. And because of that, because so many people were being affected, you would go to a hospital and you would see hospital wards full of people in these contraptions called iron lungs. Okay. And you can kind of think of as an iron lung as like the old time version of a respirator, but what these contraptions are, it's basically this metal container, this little metal cylinder that the person would lie in. Their head is not in the inside, it's actually on the outside. Their heads are here. And what the iron lung would do is it would build up positive and negative pressure. And when that happened, it would mimic the expansion and the decompression of the rib cage to help them to breathe. So that's, why we see that, what was used back then to help people with breathing. And yeah, so that's what we would see. And we don't see any cases of polio, at least in the United States anymore. Like I said before, the last known case of polio in the United States was in 1979, and that's because of vaccination against polio. Now, there are two versions of the polio vaccine. The first one was called the Salk vaccine. It was developed right in 1955, and the Salk polio vaccine is based off of an inactivated, an inactivated virus. What that means basically is they took the virus and they broke it up into little pieces so that you no longer have the full virus in its natural form. The only thing you have left are the antigens. And they would take those little bits and pieces of the antigens from the virus and they inject that into people. So that is the Salk vaccine. And the problem with that is because you're not being exposed to the full virus in its natural form, it requires booster shots. Okay, so there's usually a booster shot at about 1 to 2 months, another one at 4 months, another one at 6 to 18 months, and then finally a fourth one right around 4 to 6 years. So it requires several booster shots, and many of these inactivated types of vaccines are that way. They usually require booster shots. And then about 6 or so years after the Sabin vaccine was developed, a newer vaccine was developed called the Sabin vaccine. I'm sorry, after the Salk vaccine was developed, the Sabin vaccine was developed. Now, the one difference between the Salk vaccine and the Sabin vaccine is that the Sabin vaccine is a attenuated, or that means weakened, live virus. What they do there is they take the actual polio virus and they grow it in a lab. And what happens is that because they're growing it in a lab and it's not in an animal, the virus eventually loses its ability to cause disease. So once that happens, then they take that weakened virus that can't cause disease anymore, supposedly, and they give that to people as a vaccine. And it's supposed to offer better immunity without booster shots because you're being exposed to the full virus. It may not be able to cause disease, but it still has all of its antigens on its surface. So supposedly this one's supposed to initiate a better immunity. It is an oral vaccine, so it's not an injectable one like the Salk vaccine. The Salk vaccine is usually an injection, but the Sabin vaccine is an oral through a little solution given through the mouth. But there is a problem with the Sabin vaccine that is the reason that we don't give it in the United States anymore. The problem is that some people that were given the Sabin vaccine actually contracted polio from it. Because what happens, and it's rare, okay, it's rare, but there have been cases where the virus that they were given reverted back to its pathogenic form and started causing polio in these individuals. So currently in the United States, we typically give the Salk vaccine. Okay. Now, another thing that I want to mention here is that some people that were infected and became paralyzed by the virus initially, they regained their ability to walk or whatever. The paralysis went away. But then years later, we're talking 15, 20, 50 years later, they became paralyzed again. Okay. I did see your question. Let me come back to that. Okay. So I'm going to come back to that. Years later, they can get paralyzed again. So the way this happens is, let me go back to the picture that I had before. So remember that I said that initially, if the virus causes paralysis, it kills most of the neurons in the anterior gray horn, but it might not kill all of them. So what might happen is that you might have one or two neurons that can say, hey, I can control that muscle. I mean, I know I probably had like 100 friends that were helping me out before, but they're gone. So let me try it. Let me try to send an action potential out so I can control this muscle. And they do. For a while, they are successful in, controlling that muscle and causing it to contract. And so people can regain their ability to walk or run or whatever. But then the problem is that this neuron is doing too much work. It's doing double duty. In fact, we call these neurons double duty neurons because they're doing more work than they should. And because they're doing more work than they should, eventually, and it might take years for this to happen, those neurons will die. And that paralysis in the muscle would come back. And so when that happens, that can result in this post-polio syndrome that I'm talking about. So the post-polio syndrome is not caused by the initial virus. It's caused by the death of what we call the double duty neurons that just fatigue out. Okay. Now let me come back to your question here. Can that happen with other live viruses? It can. With other live vaccines, it can, but it seems to have more commonly happened with the polio virus. Okay, the polio vaccine, the Sabin polio vaccine. So that's why, at least in the United States, we don't give it anymore. Okay. Okay. Rabies. So rabies is caused by the rabies virus, or actually it's the rhabdovirus. And This disease is usually transmitted from an animal that's carrying rabies by being bitten by that animal. Um, Animals that have rabies, they usually carry it in their saliva. And if they bite another animal or if they bite a human being, they can, transmit the virus in that way. Now, it's really important that if a person has been bitten by an animal that is suspected of having rabies, that they get treated immediately. And I'll talk about the treatments immediately because what's going to happen is the virus will start in the skin, right where the animal bit the person. It'll start replicating in the skin, and then it'll move from the skin into the muscles. And then from the muscles, it moves into the nerves. And the nerves, now the virus will use the nerves as a pathway to travel from the periphery to the spinal cord and up into the brain. And here's the thing, once that virus gets into the brain, there is nothing you can do. It will be fatal. Like, it is a death sentence. So that's why getting the treatment for rabies after being bitten by an animal that is suspected of having rabies is extremely important, because once it's in the brain, that person will die. Okay. Now, before the person dies or before the animal dies, there are symptoms that can go along with this. Many of the symptoms are central nervous system systems where it may experience partial paralysis, especially along the nerve that's being affected, confusion. Humans and animals that have this are extremely agitated and they're extremely angry. It seems like they're angry. They can experience what's called hydrophobia, which, if you just look at the word, hydrophobia literally means a fear of water. But it's not like they're just afraid of water. What they're afraid of is drinking the water. If you were to hold out a cup of water to a human being that had rabies, they would like swat it away. They would just start crying and panicking, because the problem is that they think that you want them to drink it. And the rabies virus damages the nerves that help to control swallowing. So it's very difficult and very painful to swallow. So that's why they panic when they see water. In different parts of the United States, we see rabies caused by different types of animals. So on the East Coast, it's mostly like raccoons. In the Midwest, in some of the northern states, it's skunks, and it might be foxes in other parts of the United States. But in the United States, it's very rare for humans to get rabies. We might see about 1 to 6 cases per year, and part of that is because with a lot of animals that we have as pets, like dogs and cats, those animals are vaccinated. In a lot of other countries, the incidence rates of rabies and fatalities of rabies in humans is much, much higher, because a lot of those domesticated animals are not vaccinated, and they're just kind of in the streets, and they could cause really serious disease. So the rabies treatment, so like if you or anyone was suspected of being bitten by an animal with rabies, what do? Because you got to get it immediately, because once it gets into the brain, there's nothing you could do. So the first thing you need to do is you need to wash the wound thoroughly with soap and water. And that needs to be done to reduce the amount of the virus in the wound. Then, at the same time, you're going to get, or whoever this is, will get 4 injections of the rabies vaccine. And additionally, they will also receive antibodies against the rabies virus. So washing the wound, rabies vaccine, and antibodies against the virus. That's what needs to be done. We touched on herpes encephalitis a little while ago, or last time, where, for example, although this is rare, a person that has oral herpes, sometimes the oral herpes can travel up the trigeminal nerve into the brain, but that's more common in the very young, so like newborns, or the very old, or the immunocompromised. This could also happen in newborns. Let's say, like if a pregnant woman has genital herpes, and during birth, they could transmit the virus from their genitourinary tract into the oral cavity of a newborn, and then the virus spreads into the brain and causes herpes encephalitis of the newborn. It's rare, but I thought I'd bring that up. Now, there are a group of viruses that can cause a severe brain infection, and these group of viruses are called arboviruses. And there's a whole bunch of them. Some arboviruses are referred to as the West Nile virus, which you've probably heard before. We also have something called St. Louis virus, which can cause St. Louis encephalitis. But since the West Nile virus is one of the more recent ones, I'm going to talk about that one. Back in the early 2000s, we had a kind of a West Nile virus epidemic here in the United States. The virus is spread by mosquitoes. So mosquitoes that carry the virus, they bite human beings and inject the virus into humans, and then the blood will carry to the brain and cause a really severe brain infection. Some of you that may have been around at the time, you might remember that in addition to people getting West Nile virus infections, a lot of birds were dying. And that's because the mosquitoes would also infect birds. And the virus was actually using the birds to actually replicate more and more. Then what would happen is that other mosquitoes would bite the birds and pick up the virus from the birds and then spread to humans. Okay. So a lot of people were panicking when they saw that a lot of birds were dying. There were people finding dead in their yards and things like that. Anyway, so with West Nile virus outbreak that we had in the United States, again, we saw a pretty big spike of it in the early 2000s here. Now the thing is that most people that got infected, if they had if they were relatively young and they had a healthy immune system and they didn't have any other underlying health illnesses, in them it was usually a subclinical disease. They didn't have any signs and symptoms. This was more of a problem for the elderly and the immunocompromised. In those individuals, it did cause a severe brain infection, and many people did die from it. Now, moving on to protozoans that cause disease. There's really only one, at least one that I want to talk about, and that is the protozoan Trypanosoma brucei. It causes a disease that we only see in certain countries in Africa. It's called African sleeping sickness. And one of the reasons that we only see it in Africa is because it's usually spread from the bite of a fly called the tsetse fly, which is also only seen in certain countries in Africa. So when the tsetse fly that's carrying the protozoan bites a human being, it injects the protozoan into the blood. And you can see here, this is a blood sample from a person. You can see the little banana-shaped protozoans in here. And then the protozoan spreads from the blood into the central nervous system. Now, you might remember that from your Anatomy and Physiology 1 lecture, that there's a part of the brain, it's called the reticular activating center. And it controls a lot of different things, but one of the things that it also controls is your overall consciousness and awareness. And what this protozoan will start to do, it'll start to damage that part of the brain. So some of the initial symptoms of this is where a person will, it looks like they're just lazy. They don't want to do anything. And they're just kind of lying around. They look very tired. It almost looks like they have mono. And then they just sleep. They're just sleeping all the time. So you're just like, oh, you're a lazy bum, whatever. But then they're just always sleeping. They're just sleeping. And then they kind of slip off into a coma and they can die from this. And so that's why they call this African sleeping sickness. There are anti-protozoan medications that can be given, but they have to be given pretty early because if there's enough damage to the central nervous system, there's really nothing you can do, and the person will most likely die from it. We've touched on prions before, so I'm not going to, dwell on it too much. But remember that a prion disease is a disease that's caused by an infectious protein. And it's usually spread from animals to humans by ingesting contaminated blood or meat products from infected animals. And it causes a lot of damage to the central nervous system, especially to the brain. What you're looking at here on the left is an MRI of a person that has a normal brain, and on the right is a person that has a prion disease called Creutzfeldt-Jakob disease. And if you compare the size and the amount of brain tissue in between the two brains, the one on the right has lost a lot of tissue there. There's a great reduction in the amount of brain matter there, and so it is very destructive. Sometimes prion diseases are referred to as spongiform diseases because they cause so much damage that they leave holes in the brain, making the brain kind of look like a sponge. All right, and before we're done today, I have to talk about diseases of the eye. I know that it doesn't seem like eye diseases fits with the nervous system, but your textbook has eye diseases with this section, so that's what we're talking about here. So I want to talk about these kind of quick. There is a disease that can affect infants. It's called ophthalmia neonatorum. And it's usually caused by the bacteria that causes gonorrhea, Neisseria gonorrhoeae. What can happen is that if a pregnant woman that has gonorrhea, if they're not properly treated and they give birth to their babies, the bacteria can enter into the eye and cause a very, very severe an eye infection. Sometimes even so bad that it can result in blindness of the infant. Another one is it is caused by another bacteria that also is usually a sexually transmitted disease, Chlamydia trachomatis. Infants can also get this from their moms during birth, but also if a person gets this bacteria on their hands and touches their own eyes or the eyes of somebody else, they could cause a severe eye infection in them. So those are kind of extremes. They don't happen a lot, but they can. But if you just had regular pink eye, what are some of the causes of that? Most likely, if you've had pink eye, it's caused by a bacterium. And the most common causes of bacterial pink eye are one of these. It might be Haemophilus influenza, it might be Pseudomonas, Staph aureus, or Strep pyogenes. So those are the most common causes of pink eye if you've ever had pink eye. And those are usually treated with antibiotics dropped into the eye. But there is another more severe form of conjunctivitis that's caused by this amoeba called amoeba. And this really can be more of a problem for people that wear contact lenses. So, if you wear contacts, you're supposed to take your contacts out daily and soak it in that saline solution that you're given or you buy. And the saline solution, it kind of kills any microbes on your contacts. It might not kill everything, but it helps to kill most of the things. And then you put them back in your eye. But the thing is that, for one, you shouldn't wear your contacts for very, very lengthy periods of times without taking them out. And then you should never use tap water to wash your contacts, because tap water, even though it has chemicals in it that helps to reduce the amount of organisms in it, it's not totally sterile. There are things that are still in tap water. And one of those things could be this amoeba. So, if a person washes their contacts with tap water, this amoeba could latch onto the contact and cause serious damage to their eye. There was a case of this several years ago where there was a young woman. It was in the United States. I can't remember exactly where. But she wore contacts, but she had a nasty habit of not taking them off for long, long periods of time, just wearing them day in, day out, sleeping with them, all that kind of stuff. And when she did take them out, instead of using the saline solution, she just ran them with her tap water, and she would pop them back in. Well, she did this for a period of time, and then she started having pain and vision problems in her eyes. So, she went to her doctor, and they looked at her eyes, and the front part of her eyeball was being destroyed. She had serious damage to the front part of her eyeball. And they did samples. They took swab samples of the contact in her eye, and they just found this amoeba, this acanthamoeba, just infesting her contacts and the eyeball. And what the amoeba was doing, what an amoeba does is it eats. And what it was doing, it was eating away the front part of her eyeball, resulting in a lot of the pain and the discomfort and the vision loss. So don't wash your contacts with tap water. Use the saline solution. Okay. All right. So that was the last thing that I wanted to talk about as far as nervous system diseases are concerned. So you've got a test coming up, right? So your fourth test, test 4, it will cover antibiotics. It's going to cover respiratory system diseases. It will cover skin diseases, and what we just talked about today, nervous diseases. All right, and as per what's written in your schedule, it will open on Sunday, October 31st at 12:01 a.m. and it will close on Monday, November 1st at 11:59 p.m. Same format as last time, so 50 multiple choice questions, and you'll have 90 minutes to take it once you start. Okay, so are there any questions about the exam or anything else before we are done? I'm going to send out a Kahoots review for it, so be on the lookout for that. I'll probably post it up on Blackboard, but does anybody have any questions about anything? Not necessarily, because remember that, hold on. If a person has primary TB, they will be positive, but primary TB is not contagious. So not really. If they have secondary TB, they will be, but not with primary TB. Okay. Anything else? Okay. Well, thank you for attending. And oh, go ahead. Pneumovax, yes, it's Pneumovax vaccinates against the Streptococcus pneumoniae bacteria, and it does cause lobar pneumonia. Yes, that's correct. Children are at risk for what? They can be, yeah, they can be at risk for that and walking pneumonia. So yes, they can be, but we don't vaccinate children. It's mostly the, elderly individuals usually get vaccinated against it because they're even more prone to getting pneumonia than children are. Okay. All right. Well, I will. We won't have class on Monday because of the test. So the next time we have a lecture will be on Wednesday next week. So I will talk to you all then. Thank you very much.